Hi everyone, welcome to today's episode, episode 2 officially. I'm with a good friend and colleague, Brad Parkinson, and he's working in Western Sydney. He loves helping everyone and he loves digging really deep, but he has a special interest in autoimmunity. And we've been talking, as we do, always about health, and we love talking about it. And we're talking a lot about the difference between integrative medicine and conventional medicine and functional medicine. It can be quite confusing. So we thought we'll have a bit of a chat and talk about the differences. And so let's start talking, Brad, maybe about conventional medicine.
Yeah, well, conventional medicine being like the GPs, basically when you go and see your doctor. And basically, really what that is pharmaceutical medicine and surgical medicine, basically. It fits in that sort of paradigm. And when you go to your GP, you might get 5 minutes, 10 minutes with them. If you're lucky, 15 minutes, and then they've got to come up with a diagnosis and really point you in the right direction. And the tools that they have are the pharmaceutical medicines and surgical medicine, and then they refer you on to specialists that work in, like a gastroenterologist will work on the gut, and then an immunologist might work with someone's immunity. However, as we're about to talk about, I think it's important that you're a generalist these days, because it's all connected. You should take a holistic approach, and that's very much the big difference between conventional medicine, taking that mechanistic approach, picking apart and just looking at it, and even what they use, the pharmaceuticals and surgical procedures, they're just really working on isolated areas and treating, a lot of the time, treating symptoms. And look, great for emergency medicine. We need it. It's great for emergency medicine. Not so good for chronic conditions.
Yeah, and it is a great medicine, and it saves millions and millions of people. And if you have a chronic systemic infection and you need IV antibiotics or whatever, definitely go to the emergency. But the problem, maybe as humans, we want that immediate gratification, and we want that immediate fix. And then maybe we've taken it too far. Maybe just that hunger. I remember my mother as a child taking me, and she was so concerned with my infections, she was demanding the doctor gives me antibiotics. And the poor doctor is torn because they want to give the patient a solution. Mm-hmm. And in their toolbox, they have pharmaceuticals, and they're thinking, Panadol, and the mother is demanding, I want antibiotics.
Yeah.
So it can help, but maybe we've gone too far.
Mm-hmm. Definitely. Yeah, and look, just on that too, it's there is a lot of limitation there, especially for chronic conditions. And
yes.
I think pharmaceutical medicine has its place treating a lot of symptoms and emergency medicine, and maybe even assisting things when no other option is available. But I think, as you and I know, there are quite often many other options available that get started, and it's almost negligence from my perspective if you're going to just throw out pharmaceuticals to your patients without even considering some of what we definitely have now is evidence-based natural treatments that are a lot safer and first do no harm. So
there was that great episode on the BBC. I think it's something like doctors giving up drugs. Have you seen that one?
No, I haven't.
It's a BBC, and there was a great thing with antibiotics, and they did this study and they were measuring temperature, and they suggested to the clinic a better way rather than dispensing antibiotics. But the clinic actually decided it takes too long. So they would have to extend the consultation longer. So it was kind of like, at the end of it all, we'll give antibiotics still.
Yeah.
Trying to educate the clinic, but unfortunately for that particular clinic, they weren't willing to change their strategy.
Yep.
Yeah, but what about functional medicine? How does that
Well,
differ?
yeah. Well, look, functional medicine is basically a holistic approach, and it's a systems approach too. So we're looking at different systems of the body, like the GIT, the gastrointestinal tract, respiratory, immune system, and how they all interconnect and how one system affects the other. So it's a very holistic approach. And as we're both naturopaths, we understand holism and that holistic approach very well. And it includes the emotional aspect of it. So it includes all aspects of the individual as a person in treating the person. And then they look very much at the function of the organs, the tissues, the cells, and again, how that interacts through and affects the whole person. That approach is very, very similar to what we do as naturopaths. Even the processes involved with functional medicine is very similar to what we were getting taught in naturopathy. Though I'd probably argue that in naturopathy, we were taking in a lot more details, and we kind of look a bit broader and outside some of the scope of the evidence-based medicine that might be the only focus in functional medicine. But again, functional medicine utilizes non-invasive, evidence-based natural medicine. So they're using nutritionals and your herbals at times. So yeah, that's really the main gist of it. It's again, like what we do, they're looking for a root cause, an underlying cause, or in some cases causes, and trying to get to those and treat those to eradicate the disease. Whereas your conventional approaches really treats the symptoms as their main approach. So
maybe I could point out one extra difference about the functional medicine testing and the situation in Australia is that the government has so much financial restrictions. So the doctors are a bit torn, their hands tied, because they can't, use Medicare as let's test a lot of things. They're only testing very, very minimal pathology.
Yep.
And but if the patient is able to test a bit broader, then they can test the function of their stool microbes or their intestinal permeability or hormones, and that's just not covered under Medicare in Australia.
Yep. Yeah, it's
I
very
guess
restrictive.
So, because the government is spending so much money as it is. It's a sticky situation we're in. We want to spend on preventative medicine, but we're so sick as society in Australia. We're just trying to mop up all the diabetes and heart disease, and the government's trying to cost.
Yep.
Anyway, a little bit off track. And what about, you touched on naturopathic?
Yeah, so I think it's important people understand what that is, because most people really don't have a clue. I mean, naturopaths, I think a simple sort of take on what we do is we're basically nutritionists and herbalists, with some extra modalities even thrown in there. And we do the equivalent of 4 years of nutrition in a nutrition degree. 4 years as a bachelor's degree for naturopathy is, and 4 years of nutrition is in part of that, and 4 years of herbal medicine is also part of that. And it really puts us as naturopaths at the forefront of makes us the experts in those areas because of all those years of training and education. And as the degrees that you and I did, we get to a point where we're critiquing the literature and reviewing it and writing it out. And really the next stage for us moving on from that would be actually research itself, which a lot of naturopaths are doing. And I think a lot of people aren't aware of that. Naturopaths There's a lot of good researchers out there that started off in naturopathy for that reason. And when you get an education like both you and I received, you're really put in that position where you can pursue that. So in addition to something like nutritional and herbal medicine, we're also looking at things like homeopathy or massage. There's other diagnostic tools that we use within practice as well. And again, holistic approach. We take into consideration how the patient's feeling, their emotions, and how that ties in with their hormones, with their gut health, with everything. So, and again, we use the functional testing maybe traditional naturopaths and a lot of other naturopaths there wouldn't delve into the functional testing as much. So I think that's something that you and I both do a lot of, and when necessary. I mean, you can't take away good case taking. I think that's always the priority. But once you get your head around a lot of the functional testing, which is more extensive, as you put, as you mentioned before, it's we can do like full thyroid panel where we look at things like reverse T3. We're always probably considering the autoantibodies and everything as well, so we can rule out Hashimoto's Graves, and we can rule out stress factor to thyroid dysfunction, so forth. And I think that's an important approach, and it's a bit more of a modern naturopath's approach, using the functional testing like you and I are doing. And look, there's a lot of traditional methods that you take into consideration, but like anything, and even with the functional testing, it's part of the picture. It's always part of the picture. It's never, you never take one little thing and run with it and go, okay, we've got this test, that's it, it's definitive that's what it is. It's not like that at all. We're always looking for all the clues, and then moving forward with our patients and our treatments. That's always an individual thing as well, because we've got to get compliance with what we do. And unlike conventional medicine, where they use pharmaceuticals and surgery, we're using botanicals, so herbal medicines and nutritional medicine as well, and diet and lifestyle. They're our tools, and I think we're really placed as experts in the field with those things, because we're well trained, well educated on those things.
And how about the last area, integrative medicine? What's the difference?
Yeah, well, integrative medicine is a favourite topic of mine and yours. We often talk about it, and I think you came out strong with an integrative approach. And really, for me, understanding integrative medicine, I thought there was a real bright spark in health in general when integrative medicine was taking off in the 2000s, so right through to about 2010. It was very strong, running really strong. It's still strong today. Functional medicine's got a bit more marketing behind it, so a lot of people are seeing, because we're all connected online now, it's what happens in the US with the marketing and everything is sort of where everyone, as you know, comes into your practice. They're all talking about functional medicine and its approach and everything. And it's great. But integrative medicine for me is about the integration of all modalities and everything health related, and putting everybody on the same page. Especially those that go through and do a health science degree like we've done. You all go through and do the same subjects approved by the same authorities to get your degree and what have you. So you're all on the same page, speaking the same language, and you should be able to talk to your osteopath, the chiropractor, your doctor, and your naturopath or nutritionist, and all should be able to be talking the same language, on the same page, and there for the patient. And this is one thing I say to a lot of people is, if you're seeing someone and they really pay out on a certain modality, like if someone says, "Oh, chiropractors, don't go and see them," or if your GP says, "Oh, naturopaths, I don't know what they're talking about," what have you. Anyone that does that, who's a practitioner, just run the opposite way. do go and seek out another practitioner, because it should be about the best interest of the individual. And there's plenty of evidence base, certainly for herbal medicine and nutritional medicine. You know, there's clinical trials now. There's trials up against pharmaceuticals where it clearly shows nutritionals or herbal medicine is far better or safer than the actual pharmaceutical medicine. And now we're getting reviews on some of these, like statins and what have you, and it's not really they're not the medicines that they made out to be. So when they talk about there's no evidence, that's absolutely ridiculous. But I think the integrative approach is all about the patient, like it should be. So let's all work together the best outcome of the patient. You know, when someone comes to me, I look at what medications they're on. I look at what other treatments they're going. Do they need a bit more emotional, mental support from a psychologist? You know, and I encourage them. I refer on. And that's what we do. We're sometimes positioned as their primary practitioner because we spend so much time with them. Then we say, hey, yeah, well, maybe check out this GP. This GP is very good in this area. Or, you know, they're very good at diagnostics, GPs as well. So look, we don't quite understand what's going on with you. Go and see the GP. Let's make sure that we understand the complete picture from what they're saying and rule out pathologies. You know, and certainly if we see red flags, you know, that's one of the first things we do is to refer to a GP. But you know, if they need a chiropractor or an osteopath, I'm really there to encourage them to do that. And that to me is everybody being on the same page. That's what integrative health or integrative medicine is to me. But I'm sure you've got your take on it too.
Yeah, the same, just the same. And, you know, we and just like everyone else, we're not an expert in everything. We know herbs very well. We know nutrition. We understand pharmacology because we had to study it in our degree, and we understand a lot of different areas. But if someone is seeking out a psychologist or a kinesiologist, I'm definitely going to refer them on to a kinesiologist or a psychologist. Because that particular practitioner is going to help them. And if that's what the patient needs, then that's what they need. There's no point saying Reiki doesn't work. Even if it was a placebo, it doesn't matter.
That's
that
right.
Patient,
yeah.
And it's working for that patient. So who am I to judge and say, no, you can't see that person?
That's a good point.
Yeah, I think that has explained the difference as well.
Yeah, I think it clears things up. Hopefully it clears things up. And if not, wherever these videos land, whether it's YouTube or Facebook, hopefully people comment and ask the question.
Excellent. Thanks, Brad.
All right. Thanks, Shannon. We'll speak again.
See you soon.
Bye.
Yeah.